Hi, everybody. This is Erica Mello, and welcome to episode number 166 of Tough to Treat. And this is a shorty week for us. And this is actually an excerpt from one of my Decoding the Complex Patient course calls. So many of you do know that I have a course called Decoding the Complex Patient. And I've launched it a few times. And I'm actually going to be launching it again over the summer. And part of that whole course is actually our calls. So this was a very small excerpt, probably about 8 minutes, 9-10 minutes long, on meeting patient expectations. I had a question from one of the participants regarding how do I explain timelines to patients? How do I get them to buy into the timeline? And because a lot of patients ask, well, how long do you think it will take? Yeah, that's a loaded question, right? Because if you don't come in for 5 weeks, then you show up on my doorstep and say you're not better, well, that's a problem, right? So I think up front, we need to really manage patient expectations. And so the title is very apropos of this episode. It's called Meeting Patient Expectations, Navigating the Journey to Progress. And it is a journey because we have to manage their expectations regarding improvement. And I believe that needs to be done from the get-go. And the patient needs to know that they have a job to do, because that'll make your job easier and it will make their progress, I would say, easier or quicker, for lack of a better word. So I do talk about a few patients in this episode, but bear in mind that my patient population is they're the tough to treat ones, right? They're complex. They've been everywhere, and they're sitting on, in my room. I'm like the last resort. So is it going to be 2 months? No. Okay. These people have a lot of movement patterns and a lot of issues they need to unravel first. So I think that if you develop a script, or if you develop, a way to sort of talk to your patient about their expectations, it has to come out naturally. So you'll hear that in this episode. If anybody has any questions, feel free to reach out to me or Susan regarding any of our episodes. And for the new listeners, thank you so much for listening to our podcast. And if you have not already, please go to toughtotreat.com. We have all the episodes there. And if you have any questions on anything, you can type the keywords in the search bar, and up will pop all the episodes regarding that particular keyword. And we also have a couple PDFs if you opt into our newsletter on clinical pearls, as well as effective sleep tips for persistent pain patients. Thank you again, and enjoy the episode. The first question is, and I get asked this a lot, is, her question was regarding timelines for complex patients. And, since my population is mostly out of the acute stage, how do you go about making timeframes for patients and meeting their goals? And how often do I see these patients? And in one of the videos, I discussed about financial constraints with patients and over how long of a time period. And so it's a great question, because by the time people get to you, they've spent money and they've spent time. And even though you're just seeing them for the first time, it's really easy to become somewhat defensive. You're like, well, you're only seeing me twice, that type of thing. And I still do it. It's hard not to take that personally sometimes. So I think that for me, I explain, and this is what I've been doing a lot more lately, and I would urge you to all try this. I ask my patients, on a scale of 1 to 10, what level of commitment do you have towards doing what needs to get done to get you back to walking or tennis or sitting for long periods? So, I need to know on a scale of 1 to 10, how committed are you to this process of doing what I tell you, of coming in? And if it's below a 5, I tell them, you're not really committed. I would suggest that you come back when you're like a 5 or 6 or 10. Most people are above a 5. But I would urge people to try that. And the person's not going to lie and say I'm a 1. but it shows that you need their commitment, number one, because if you don't get it, don't waste your time and don't take their money, because it'll just turn out badly in the end, I think, because if they're not committed in doing what you tell them, you can certainly ask this throughout the time periods. That's something new that I'm doing. It's a little confrontational, so it'll have to come out, I would say with ease when you ask. And I always say, oh, I have coaches and they always ask me how committed I am. And so I'm going to ask you, how committed are you? And it comes out naturally like that. So that's sort of what I do. And so in terms of like timelines, I always say to the patient, I said, look, I know you're paying me, out of your own pocket. Since you've had problems for so long, this will not be a quick fix. And they know that most of the time, this will not be a quick fix. I will do my best to get you to identify your drivers and give you an exercise program that you can do. But from you, I need that commitment, and I need you to come in at the beginning consistently, well-intentioned. And I say, because of that, because we're trying to change brain maps, we're trying to change movement patterns, we're trying to create a habit, we're trying to take you out of your dominant pattern. Whatever you say, whatever words you use that are comfortable, that's what I suggest you do. So I say all of them, I'm trying to change, we're trying to develop a new habit. I'm trying to change brain maps. I'm trying to down train your old habits. I'm trying to give you choices for movement. That will not happen if you come in once every 3 weeks. It won't, it won't happen. And if the patient says, well, I just can't afford to come in, I will say, look, okay, then the expectations are this. If you can come in once, I'll give you a thorough evaluation. I'll do the best I can. I'll tell you what you need to do at the beginning. And if you don't come back for 3 weeks and you don't do what I tell you, you will not progress as quickly as you should. And some people just can't come in because of traveling and of financial. And those people will take longer, but they need to know that up front. If they say, I only can afford this, then I will do, then, you will know that you can't, you're going to have to pick and choose exercise, and tell the patient, I often say, because let's say I'll just use my, like a rower, as an example. I'm trying to think of somebody in the course. Let's see, I will use 2 things. So my, the pelvic girdle from the foot driver, her foot's are driven. She was a physio. She didn't come in. She came in like 6 times in 7 months. She was a physical therapist. She knew what to do. I told her what to do, and she did it. If you have patients like that and they're committed and they'll do exactly, and they're somewhat intelligent about their body, then that type of scenario can work. That is not the norm. My patient in the module where she had it was the woman at the hip, Maureen, not Maureen. God, I'm trying to think of the which one. It was the woman who had the hip, the hip driven. I'm sorry, the pelvic, the pelvis and the foot driven hip. She had hip arthroscopy. So, Mary, I think it was. Yeah. So she was not local to me. So she came in 2 visits in a row, and then she would come in once a month. And then I would progress her virtually. Okay. That I'm okay with, because she was highly committed and motivated. It took her long. It took her probably 6 to 7 months, but she was not local. These timeframes for patients, I'm treating patients now, there are a few that are good in 2 to 3 months, but that's not the norm with my caseload. It's not. I will upfront, I'm seeing patients for probably 4, 5, 6 months, almost longer. Okay. But there's a significant change between the 3 and the 4 a month where they're like really improving. And could you discharge them at that point? Yeah, I wouldn't. But these types of patients, they're so driven to get better. When they see any ounce of improvement that they have not seen from prior practitioners, they will find a way to come in. I will tell you, I'm still experiencing this every day. I'm treating now a tennis player, recreational, but he was a former tennis coach before he started his more sedentary job. I've been treating him since on and off. So he's been traveling a lot. So I would say in the clinic, probably 5 months. But it's been longer from a time frame, but he's taken 2 months off. I haven't seen him. That's not optimal. It took literally 4 months for him to see amazing gains in his tennis. Now, I keep telling my patients that, look, if you want to go back to a sport, it's going to take longer than if you just want to sit at a desk. It's a different process. I have to progress you through a long exercise program, and not long in the sense it's going to take you long, but you need to go through, and I explain open chain, closed chain, neutral, non-neutral, and I explain this in the video. In the session to them. Doing wall squats is not going to get you to play tennis. You need to go through this, and I need a level of commitment that you're doing exactly what I tell you. If you're not, you're not going to if you don't do it, you're not going to get there. So depending on your patient's goals, it may take long, or it may not. I've had a couple of patients recent months, 3 visits, not common at all. They're like, oh, I can't believe this amazing progress. I was like, oh, that always worries me with these patients, to be quite frank, because they've taken a long time to get there. I always say it's taken a long time for you to get there. It's not going to be a quick fix. I would say that. Looking at your history and your timeline, you've adapted great, and you've adapted well for a long time. It's going to take a bit of time to unravel. It will not take 1 month. And I always say, in a few months, if you're not seeing gains, then we need to have a conversation. And if there's a psychosocial component, then that adds another layer. So I hope that answers your question. It's probably a long-winded answer. Those are timelines. I mean, there are a lot of patients of mine who, after 4 or 5 months, they're good and they come in for maintenance. That's different. I have a lot of patients who do that, who come in for maintenance because they've seen, they've gotten better. And they're like, yeah, I'll come back once a month, just check in. I have a problem with that. And they do. And I think that's how you should frame it to your patients. You need a commitment up front. And if it's financial, they can't do it. They need to know that over time, it's just going to take longer. It's just going to take longer. And if they know that, then it should be okay. It's the expectations that need to be set up front. This is what you should expect from how many visits, et cetera, et cetera. I don't usually tell them that, though. I don't say it's going to take 10 visits, because if they don't come in for 5 weeks and they're at their 10th visit in 10 months from now, that's different, right? So it really needs to be set up front that they need the level of commitment and consistency at the beginning, like front load the visits for maybe three for a month, come in once a week for a month. I treat patients for an hour. I don't see patients twice a week, unless there's something like I did at the end of the year on one of my patients, because she had met her deductible and she wanted to really work on some other things. So that's when I did that. But mostly it's just once a week. And I'm just looking at the question again. And I think that's, if you can get them coming in once a week for a month, you're good. And then just if they want to go every other week, but they need to do ultimately they need to do what you tell them and what to avoid. And if they don't do that, then that's a problem. So I think you all know that. So I hope that answers your question. If you have any other questions or follow-ups on that, please let me know.